Hi, this is Maggie, your physio. So I'm here to do the second series of lumbar spine decompression. So don't try this unless you already did the first one. That's the lumbar spine decompression 1 exercise, because you want to make sure you don't have pain with that. Also during this exercise, if you do feel any sort of discomfort in the front part of your hip or pelvis, then you're still not ready for this. You might have to talk to your healthcare practitioner to get a little bit more help to loosen up that area first, or keep trying some other exercises before you do these ones, okay? So same idea as with the first series. You want to always focus a lot on the breath, because that always helps. That deeper breathing helps to actually lift a little bit your lumbar or your other vertebrae from the lumbar spine. And as you exhale is when you really want to do the deeper, forceful, more contraction of muscles, okay? So we're going to start the same way as we did the other one, with a little bit of the pelvic tilt. And then we're going to go on to some stretches for the muscles that surround the outer part of your hip. Usually when there's back pain, the hip muscles, the glutes, the piriformis, obturator, there's a lot of muscles there that get really, really tight. And so we're trying to relax them and contract them so that they loosen up and there's more blood flowing through the area. And that way we can help to open up a little bit more of that lumbar spine. So we're going to lie down on our backs. And so the first part is doing about 10 repetitions of that pelvic tilt exercise, or posterior pelvic tilt, where you take a deep breath in, and as you breathe out, you contract your pelvic floor muscles and then the deeper abdominal muscles, and then start moving that pelvis backwards to try to get a nice scoop of that tailbone. And then you're going to repeat that 10 times, nice and slow, coming back down, relaxing. Okay? And after the 10 pelvic tilts, you're going to lengthen. I usually start on the side that's more aggravated. Sometimes both of them, it's pretty much middle lower back, so then it doesn't matter. But if you have one side that's a little more tight or more uncomfortable, that's where you start. So let's say it's my right side. So I'm bringing my left leg down. And what I'm going to do is pull the leg across my body, just enough to feel some sort of stretch on the outside. I want to keep the same side arm on the ground, so do not let it elevate that I'm twisting too far, because I want to try to get as much rotation on that lower part as I can without involving the upper part along, okay? Find that position. There should not be any pinching feeling in the front, in the groin, or in the hip. If there is, we're not ready to do this one yet. And then as you're holding it here, when you breathe in, you relax, and as you breathe out, with your opposite hand, you're going to try to push gently down a little bit more. So every time you inhale, you relax. Every time you exhale, you try to go a little further. But again, it should just feel like a nice long stretch, an elongation, no pain anywhere. And you're going to do that 10 times. After those, you're going to go ahead and either push into your hand in that elongated position. You're going to press gently into it. And again, I want you to really focus on pulling the deeper abdominals in and the pelvic floor muscles. When you exhale, that's when you're pushing. So inhale, you relax. As you exhale, pull the pelvic floor muscles in, deeper abdominal muscles, and do a gentle push into your hand, and your hand pushing into your knee. So you're not allowing movement to happen, but you feel that these two structures push against each other. And then on your inhale, relax, potentially go a little further. Exhale, push. Inhale, relax. And you're going to do that 10 times again. At the end, you probably have gained a little bit more range. This feels a little bit more stretched out. And then you're going to maintain that hand in that position. And on your inhale, again, relax. On your exhale, think of your sitting bone pointing straight down. You're going to try to get a little bit of that push of that sit bone straight down. And then inhale, relax. Exhale. A little bit of a push. You don't really feel a big movement, but you're gonna feel a nice opening here. Try to, obviously I am looking at the camera to teach you, but when you do it, try to maintain your eye gaze pretty much up on the ceiling, maybe a little bit down so that your neck is not being strained. And your shoulder obviously is on the ground, okay? And after you're done with that, before you bring the leg, you're gonna think of bringing your spine towards the floor, and then you can roll out of that position, okay? So don't do this series if you haven't done the first one with just the pelvic tilt without discomfort. Then you're allowed to pass on to this phase. And then from there, usually we start doing quite a lot of exercises that are Pilates based, because those will work a little bit more the deeper stabilizers of your hip and core to help decompress your lumbar spine. If you have any questions, let me know and enjoy. Thank you. Bye.